Hello, it's Dr. Tugbiyele here, the online Urogyn again. For those of you who are happen to be meeting me for the first time, I am a board-certified urogynecologist, and I take care of women who have problems with their pelvic floor, essentially their bladder function, bowel function, sexual health. And so many women do have these bothersome problems with their pelvic floor health, but are too embarrassed to talk about it. And in fact, you may be a woman listening to me in this video right now who has, for example, bladder leakage. And you may feel embarrassed to talk about it. You've probably been living with it or putting up with it, and you feel like you're alone. But I'm here to encourage you that you are not alone. There are a lot of women who have this condition, and there are actually safe and effective options that can help improve the quality of life and keep it from getting worse. So while I know it's probably not been easy to talk about, I actually would like to help you today. So let's talk about it. So in my previous video, we talked about stress urinary incontinence, or leakage of urine that occurs with laugh, cough, sneeze, exercise, bending over, or even with sex. And we talked about how these are conditions that are very bothersome and how Kegel exercises can actually help to strengthen the pelvic floor and improve on it. And now, however, while a lot of women do notice a significant improvement in their leakage with Kegel exercises, there are some women, however, who do not notice a significant improvement in with Kegels. So if you're a woman listening to me today and that's been your experience, where you've been doing Kegels and you haven't really noticed it improve, well, I'm here to talk to you about another option. And that option is actually pelvic floor physical therapy. And this involves seeing a specially trained pelvic floor physical therapist for about an hour, once a week, typically for 2 to 3 months. And they will work one-on-one with you to help to strengthen your pelvic floor muscles, show you how to do them correctly, effectively, and help to get them stronger. Ultimately, you'll start with working with them and then work on your own. And that can be additional benefit above and beyond doing Kegels on your own. Another option that you have is something called a pessary. Now, a pessary is like a device similar to a diaphragm. It gets fitted in the vagina. It helps to support the bladder and the urethra. It's kind of like a device that we want it to fit well. And so it's like shopping for a shoe. You find the right fit, and when you find the right fit, you kind of forget that you have it on. So ideally, the ideal pessary should not be too small that it falls out, should not be too big that it hurts, just the right fit. And in providing that support, many women do notice that they can do their activities, like strenuous activities or exercise, if they have a pessary in place, and notice that it helps with the leakage. Some women do learn how to remove it, clean it, and put it back themselves, especially women who are sexually active, because they find that they have to do that for obvious reasons. But for women where that doesn't apply to them, the pessary can actually stay in for 3 to 4 months at a time before it's actually removed, cleaned, and replaced. So, this is another, option that's effective for women with bladder leakage with activities, and that's the pessary. So I truly hope this video helped you and encouraged you that there is hope. You don't have to live or put up with it. There are 2 additional options that we talked about in this video: pelvic floor physical therapy and a pessary that can actually help you and improve your quality of life. And so I created a guide, actually, that answers the 5 most common embarrassing questions about your bladder that you are too embarrassed to ask. And I came up with this guide after talking and educating tens of thousands of women over the course of my career as a urogynecologist. And I thought it would be very helpful to kind of put it together, and I'd like to be able to share it with you. And so if you'll find the link in my bio, and just click that link and you'll be able to get that guide to you. Okay. And so, again, my passion is really educating women with the best information that they have to take the best care of their bodies and their pelvic floor health and improve their quality of life. And so if this video encouraged you and helped you, please do share it with another woman in your life. A lot of women live with it, are embarrassed, and don't want to talk about it, but please do share it. And I also encourage you to follow me on Instagram here at Dr. Tugbiyele_Urogyn, as well as subscribe to my YouTube channel, Dr. Tugbiyele, for additional videos in the future. Okay, so until the next video, take care, and remember to take care of your pelvic floor.